The Acting Premier is right in terms of the AstraZeneca and the vaccination program. Our position, as the Acting Premier has pointed out, is pretty clear. We want to make sure that we get the maximum number of available vaccines as quickly as possible into the arms of many Australians as possible. Last week's changes from ATAGI, which we support, changed the equation as to how distribution needs to be managed as the Commonwealth seeks to source more Pfizer and other vaccines on the global market. That's going to take some time, and in the meantime, we've been talking to both the Commonwealth and to other states about what does a redesigned system look like. And as an initial step in that process, we're doing the arrangements that the Acting Premier has pointed out, making sure that we continue through our state hubs to prioritise Group 1A and 1B high priority workers, particularly with the available Pfizer vaccine. And given what we have seen is a drop-off of the ability to recommend AstraZeneca to under 50s as the non-preferred vaccine, but knowing that it continues to be preferred for over 50s, working with the GPs who are really calling for more vaccines to be made available to them in their distribution networks, to redirect for a period of time, 2 weeks, the state's AstraZeneca allocations to the GP network, and to make sure that we get as many vaccines into people's arms as quickly and as possibly as we can, safely as we can, in an environment that has changed, and use the next few weeks to redesign a system that works for all age groups, that brings into account all of the different restrictions and difficulties that the ATAGI advice has created for us, and to sustain momentum and to maintain community confidence that this vaccination program is going to work, and we just have to redesign it in line with the new systems that we have in place, target those most at-risk groups, our frontline healthcare workers, our border workers, our high priority healthcare workers, our hotel quarantine staff, and indeed work with our GP networks to make sure that our most at-risk groups in the wider community, particularly older Victorians, are prioritised for their vaccinations. We think that's a sensible way to proceed, and we'll continue to work with the Commonwealth and the other states while we're doing that to redesign a system that delivers for all Australians a quick, safe vaccination program that gets us out on a pathway out of this global pandemic.